Scalene syndrome is a very common nerve condition that I treat in the office. It occurs because the muscles on the side of the neck get excessively tight. The consequence when this area gets excessively tight is that these muscles become compressive on these structures, which are nerves. This is called the brachial plexus. So this will lead to issues such as shoulder pain, can be neck pain, can be even upper back pain, pain down the arm, even numbness and tingling into the hands and fingers. So how do we treat this condition? Now, the muscles on the side of the neck can be worked at home, and I'm going to show you. What I do is I landmark so you can find these areas. With my face being neutral to my body, what I do is I take my fingers to find the angle of the jaw. That is the point here. Take two fingers, I slide that down to the collarbone. You will notice my hand stays flat. I do not like any bridging up of the hand. One thing to keep in mind is this is a very sensitive point. This is a nerve entrapment site, so if it's problematic for you, yes, it can be sensitive. So we slide down just behind the collarbone. As you can see, my fingers are there. I like to reinforce, and then I tip my head toward my fingers. This is a windshield wiper movement. We are not rotating. Rotating will open and close the door on those nerves, that tunnel. So what I like to do is a windshield wiper movement. I press and then I hold it for 5, 4, 3, 2, 1, a 5 count. Then I move up toward that initial spot very incrementally. It's a very small movement. And again, I start toward my fingers. I squish, press on the muscle. 5, 4, 3, 2, 1. I'm going to move up another segment. In total, there will be 4. 5, 4, 3, 2, 1. And then I'm going to hit my 4th spot up from the collarbone. 5, 4, 3, 2, 1. If you're wondering how much pressure I'm giving about 50% of pressure when you begin. You can work up to about 75% of pressure. We don't want to be too aggressive because we're in the area of the nerves. Now we want to hit the second line of muscle, which will be earlobe, straight down to the collarbone, right in behind the collarbone, flat hand, reinforce, same move again, 5, 4, 3, 2, 1. I come up incrementally, 5, 4, 3, 2, 1. And I'm going to do 2 more spots for a total of 4 spots on the second line. 5, 4, 3, 2, 1. Now, those 2 lines are generally what we want to hit for a Scalene syndrome if it is affecting the brachial plexus. But there is a third scalene muscle called the posterior scalene, and that can compress the nerve going to your upper back. For some of you, I may have instructed you to hit those first 2 muscles, and if that's all you need to do, but it can still be beneficial to do the third line. How do we do the third line? We put those 2 fingers on the top of the trapezius muscle, your trap here. You shrug up, you're at the top of it, and then you let it relax, and you are where you need to be. I compress. Then do the exact same movements up a vertical line. Same manner, 5 count, 4 spots up the line. I squish and then I tip. Make sure to not go too fast and make sure to hit each of those 4 spots incrementally, 1 time through the muscle, and you'll be doing that twice a day.